We'll quickly get to look at tuberous sclerosis of the kidney. Tuberous sclerosis of the kidney. So, for the tuberous sclerosis of the kidney, this is how grossly it could look like. Yeah, and on imaging, this is how it could also look like. So it's so big indeed. Okay, so it's actually a genetic disorder. Okay, it affects many kidney organs, but here we're talking about the one that affects the kidneys. So it affecting the kidney is quite common. Okay, so what's the basis of this disease? There's a mutation in a gene known as the TSC1. Of course, that's the tuberous sclerosis complex 1, which is also known as hamartin. We also have the complex 2, also known as tuberine. So, okay, sorry. The hamartin is a protein which is made by this. The tuberine is a protein which is made by this. Okay. So those proteins normally they should what regulate the mTOR pathway, which controls how cells are growing and proliferating. So there's loss of function, there's uncontrolled cell growth, leading to what? Tumors in many organs, including the kidneys. Okay. So renal manifestation. When it comes to the kidney, you have renal angiomyolipomas, which are benign tumors composed of blood vessels, smooth muscles, and fat. They occur in about 70 to 80% of patients, often on one side, two side rather, bilateral. Okay, and there's risks of this, things busting up, and there's a whole lot of bleeding. So there's usually bleedings, into urine. You can also have cysts, which can resemble polycystic kidney disease. Then you can also have cancers. Okay, can also have cancer. So clinical manifestation, there's a lot of pain around the flanks. There's blood in urine, hypertension because there's backlog of fluid in the body because the kidneys are not functioning very well. The kidney failure is progressive. Okay? So you can do images like ultrasound, CT scans, MRIs, those. Management is you keep following up on images to see how the tumors are growing. Okay? They can also give drugs that will block the mutations in those pathways. So we call those drugs the mTOR inhibitors, like what? Everolimus, sirolimus. Okay? Yeah, so I also do nephrectomy, either total or partial.